Traveling is something most of us love to do, but what if you get hurt, catch a bug, or you just want to be careful and hope to avoid any mishaps? ABC News medical contributor and cardiac surgeon Dr. Chris Magovern is here with some tips for travelers when going abroad. Welcome, Dr. Magovern. Great to see you.
Great to be here, Tanya.
I understand you just returned from a trip abroad, so you're the perfect person to talk to about all of this.
I think I am.
Tell us, what is the biggest worry travelers should be worried about when they go abroad?
The biggest thing you should be worried about when you travel abroad is getting hurt, being involved in an accident of some sort. A vacation is an adventure of sorts. Oftentimes you're outdoors, you're near the water, you're participating in sporting events, you're letting your hair down, you're trying to have fun. Accidents can happen, so sort of be prepared for them.
And what if they do happen? What if you do get injured?
Well, if you get hurt badly, you need to obviously find medical attention. That may be hard in some underdeveloped countries. If you can't find it right away, you can go through your hotel, you can go through your credit card company. The best way to find proper medical care is through your embassy. And what you need to recognize, Tanya, is when you are in a foreign country outside of Western Europe, the medical care is very, very different than what you're accustomed to. They may not sterilize instruments. There are 40 countries throughout the world that don't even check for HIV in blood. So if you're sick, you're in a pickle, and you need to get home. You need to get home fast.
Well, there can often be a language barrier as well, right?
The language barrier can be awful, depending on where you are. But I tell you, the single most important thing when you're injured is figure out how to get home. And we have ways of evacuating people through ambulances, air ambulances, and there's some credit cards that have policies that permit that. There are insurance policies that you can take out before you go away. If you're young and you're going whitewater rafting or mountain climbing, think about it. You need to have a way of escaping and getting home.
Absolutely, that's very good to know. Now, what are some of the most common medical problems travelers face?
Well, the single most common problem that travelers face is Montezuma's revenge, or traveler's diarrhea. They've got different terms for it. We worry about contaminated water. When you are in Central America, South America, Africa, the Middle East, the Far East, you cannot trust the tap water, period. If you're drinking tea or coffee and it's boiled, it's fine, but don't even brush your teeth in it. Don't trust ice cubes. Don't trust any food that's been washed in it, because the salads, raw vegetables.
So stay away from all of that.
Those are the foods that you need to avoid. If you're eating fruit, make sure you peel it yourself, because that's how you're going to get diarrhea, and it can be miserable.
All right, so bottled water, peel the fruit, stay away from fresh fruits and vegetables.
You got it.
Lots of starches and protein you're going to be eating, but that's
meat and carbonated beverages.
Right. Now, what should you do if you do happen to get it?
Well, if you get it, you're going to get dehydrated. It's going to go right through you, so you need to hydrate yourself. You need to drink water. What's even better is some kind of electrolyte formula, like Gatorade, which you can get. The other two things that you want to do are try to limit the amount of diarrhea you're having by taking Imodium. And if you're smart, you brought that with you, so you can take it. If you're even smarter, you've spoken with your doctor before you left and got a prescription for some antibiotics, which you take with you. And you take that, and that will really nip it in the bud. So there's some preparation involved.
Now, speaking of preparation, you need to think ahead a little bit too before you head abroad, right?
That's an excellent point, Tanya. Now, if you're going to Paris for a long weekend, you don't need to worry too much about it. But if you're going to sub-Sahara Africa for 2 weeks, you need to think about it. There are doctors that specialize in travel medicine. Not only will they tell you what you ought to bring and what you ought to look out for, they can give you medications or immunizations before you go to prevent you from getting typhoid, yellow fever, rabies, the kind of illnesses that are endemic to some locations.
And you have to remember, of course, your inhaler if you have asthma, your EpiPen if you have allergies, all of that.
You better believe
crucial,
it.
Right?
There are lots of things that you need to pack in your DOP kit, and those are some of them. You highlighted on those. If you take prescription medicines, you need to take them with you and take a list of them. You need to take silly things. Motrin is hard to find even in Europe. If you are worried about bug bites, cortisone cream, it's good to bring bug repellent, because a lot of these illnesses are spread by mosquitoes. If you're prone to motion sickness and you're going to be on a boat or little cars, have your physician prescribe something for that. If you're going to Machu Picchu or Mount Kilimanjaro or Nepal, where you're above 8,000 feet, you need to worry about altitude sickness, and there are medications that you can take for that.
Right. Now, of course, those are all the sort of the medical things, but also when it comes to your wardrobe, you need to be kind of safe about that too, right? If you're going hiking, you're going through the woods, you need to bring appropriate clothes for that.
That's a great point. And if you're going to a tropical location where we talked about mosquitoes, you want to worry about covering up with proper clothing so you don't get bitten.
It's so easy to take for granted the kind of immediate medical care we have here. You have to change that mindset and realize that just assume that nothing will be easy and nothing will be immediate.
It's so true, and I had this very experience in Italy just 4 days ago. My brother-in-law, who has bad asthma, didn't bring his asthma medications because he's been fine in the States. He got really sick. We had to take him to the emergency room. I was barking out orders. I'm a cardiac surgeon from America. This is what we need to do. And we finally got him settled out, but no one understood me. And what I realized, the single most important thing that I could possibly have had over there is my BlackBerry.
Yeah.
And I was able to call my sister, who thankfully speaks Italian and could communicate. So you need to be able to have someone on call for you who can translate for you.
Right, and keep your devices handy as well.
That's right.
They come in. That's actually a whole new use for them, it appears, when you're abroad.
There's not only that, Tanya, you can use them to photograph. I have a physician friend who travels, who takes care of patients that travel. He has said that when patients travel abroad, they have photographed a rash or a cut they have had, emails them to him, and he's been able to diagnose it over the internet and tell them what to do.
The power of technology.
That's right.
And finally, I just want to ask you, you say it's important to bring your medications if you have them, but is one of those reasons because medications often have different names in different countries? That's
an interesting question. Not necessarily. You just need to have your medications because they may not have them abroad. Interestingly, it's very easy to get them. You don't necessarily need a prescription in Europe. You can walk up to a pharmacy and get just about anything you want. But 30% of the medications abroad are counterfeit. So you want to have your own so that you're sure. And pack them in your carry-on. Don't pack them in the suitcase so you have them in case you're delayed.
Come prepared and have a great trip, right?
That's right.
All right. Thank you so much, Dr. Chris Magovern, for all those great tips. I feel armed and ready for my next trip, and I hope you do too. For more information on this topic and others, log on to the health page at abcnews.com.